nasal cannula at 4 liters per minute with the FiO2 at 24% to 44. For every liter, you would add 4%. So for example, 1 would be at 24, 2 would be at 28, and so on. Now I am reviewing the patient's chart. The patient has shortness of breath. He has an elevated pulse rate. He's looking a little pale and he needs oxygen. For this procedure, we're getting a stethoscope, a watch with the second hand, a pulse ox, and hand sanitizer, gloves, humidifier, nasal cannula, and oxygen. You would knock when coming into the door. While introducing yourself to the patient, you would put on hand sanitizer, at least 15 milliliters. You would rub it all over your hands and apply gloves. Hello, Mr. Smith. I'm Kseniya. I'm going to be your RT for today, applying your nasal cannula. And before we do the procedure, could you please verify your identity? For the purposes of this video, he identified his identity. He is Mr. John Smith, and I'm also checking his wristband to double check that it is Mr. Smith. Okay, Mr. Smith, I'm going to be applying your nasal cannula. The purpose of this procedure is to make your sats higher. Currently they're at about an 80, so we want them to be in the 90s or the 100s. And the certain risks and precautions with this procedure would be you would have a level of soreness or dryness with the air. And safety precautions would be to stay away from flammable items because the oxygen could combust. Do you have any questions, Mr. Smith? No? Okay. The indications for oxygen therapy are low sats and low oxygen tension. Additional clinical indications could be an elevated heart rate, elevated respiratory rate, and the patient's appearance. Our patient today has a little bit of blue in his face, which means he has low oxygen. That is why we are giving him a nasal cannula. And before we apply the procedure, we would do simple vital signs like pulse, respiratory rate. We do their sats using a pulse oximeter, and we assess the color and level of dyspnea. So his color is a little blue, and his dyspnea, he's having increased work of breath. And right now I'm going to be taking his pulse for a full minute using the carotid artery, making sure not to use my thumb because it's got its own pulse. Okay, your pulse rate is at 95, which is good. And next would be your respiratory rate, and for the purpose of this video, I'm telling that I'll be assessing his respiratory rate, but in real life you would not tell the patient because they could change their respiratory rate. So you would also measure this for a full minute. Respiratory rate is 18. And next would be taking his sats with the pulse oximeter. You would place this on his finger. For the purpose of this video, I'm going to act like I'm putting it on his finger. You would hold it on for a minute. Okay, Mr. Smith, your oxygen is at 83. And we'll be applying your nasal cannula. I'll be applying your nasal cannula now, and I'll be setting it at 6 liters a minute because you're having increased shortness of breath and he's got low sats, so I'm going to put him at a little bit of a higher flow. For a low flow cannula, the 6 liters a minute is the highest it can go. If the patient is needing a higher flow or a higher percentage of FI2, we would put him on a higher flow nasal cannula, which has a higher flow and a higher percentage. And this 6 liters a minute would be at 44 FI2. This is our oxygen tank, and we're applying our flow meter, which measures the flow. We would use this to crack open the oxygen tank, make sure the oxygen's flowing. And I'm going to go ahead and put him on a humidifier because I'm at 6 liters a minute, and higher than 4 liters a minute on a nasal cannula, you would have to add a humidifier. So I'm going to go ahead and add it for you so it's comfortable and you're not sore in your airways. And I would go ahead and fill it up with sterile water, attach it to this oxygen tank, and then the nasal cannula port will go right here. For the purposes of this video, I'm going to pretend it's attached. So this nasal cannula port would go in the humidifier. I'm going to go ahead and make sure that everything is working properly. The pop-off valves are not open. Oxygen is flowing. Everything's working correctly. And I'm going to go ahead and put the nasal cannula on the patient, making sure he's comfortable and everything's fitting correctly. Perfectly around his ears. And Mr. Smith, are you okay? Are you comfortable? Yes? Mr. Smith, are you comfortable? Everything working properly? Yes, the patient is comfortable. Everything is working perfectly. Now, just to assess and make sure that the procedure is working correctly, I'm going to put the pulse ox on his finger again. Measure it for a minute again. Okay, Mr. Smith, your oxygen is now at 92, which means the oxygen therapy is working and his oxygen is starting to rise. And now I'm going to decontaminate my hands, taking off my gloves, throwing them away, and putting hand sanitizer on again. And while I'm doing this, Mr. Smith here had a question about potential complications with COPD. And those are COPD patients live with higher CO2 levels, so we would not be able to put them on too much oxygen because it could be very hazardous to them. Okay, patient is comfortable. I left him there. And now I'm out of the room. I'm recording the data that I used, what oxygen flow I set him at, the equipment I used, his SATs before and after. And the physician is happy with all the progress, so he's leaving it at the 6 liters a minute and the 44%. So that's it.